When I first started getting filler about 8 years ago, I didn't really do my research. If you go to someone who's really not as experienced, you can get the wrong product under the eye. And I think really that's what happened to me. I didn't even know that I had filler migration. I just thought that I just needed to get more filler. I'm Rachel, and I'm getting my under eye filler dissolved today. I started getting filler under my eyes at the age of 23. People would always ask me like, Rachel, did you sleep well? Are you okay? I decided to finally just do something about it, to feel more confident. I was actually really happy, and it was something that I was maintaining. But in the last few years, every time that I would do it, my under eyes would actually start to look worse. That the bag would appear bigger. It's very purple, and it's actually because the filler is migrating. So today I'm here to dissolve my under eye filler.
I'm Dr. Durairaj. I'm a facial plastic surgeon in Los Angeles, California. My practice is Beauty by Dr. K, and I specialize in artistic treatment of faces. If you've had under eye filler and you can see a blue discoloration under the eye, kind of like a Venus lake, that is called the Tyndall effect. So if you can see your filler and you look more tired and more blue, you should probably get it fixed. Rachel, it's so nice to see you again in the office. We had talked before that you felt puffy, swollen, and noticed that your old filler was looking really prominent under your eyes. The types of filler that you had in here were gel fillers. One of them is very hydrophilic. It sucks a lot of water content into the tissues, and that can create this long-term swelling issue. That filler should be adjusted and softened or dissolved. We're gonna start with just something to make you more comfortable. This is topical numbing cream. It's a triple antibiotic. And the injection stings a little, so this just numbs the skin surface. It also has the benefit of making things look a little juicy, swelly, and it makes that little area that we have to treat protrude so I can see it just right. As part of my preparation, I will palpate and outline the area where the filler feels like it's conglomerated. And now we are going to give you the Eyeliner shot, and this is just like a little miracle because really instantaneously you can start to see the dissolver working. We will draw up and inject the hyaluronidase very carefully with attention to avoiding the vascular and neurologic structures under the eyes, and with care taken to avoid bruising as much as possible. This can be somewhat stingy for the patient, so we treat the patient very quickly. Stinging subsides within a minute. Hyaluronidase is our enzyme that dissolves the filler virtually instantaneously. It's very fast acting. 50% of the product is dissolved instantly, and the half-life of the enzyme is 2 minutes, so it works super fast. The remaining of the dissolving process occurs gradually over 2 weeks. When we dissolve the filler and take the filler out, it's going to alleviate so many problems. It takes away blue discoloration, it takes away puffiness and bulging. It leaves you with a mild hollowing when the filler is adjusted, but we can fix that later. All right, you can see that already it's looking improved.
Oh yeah, amazing. I'm shocked that this is the result now. I can't imagine what it's gonna be like in a couple weeks.
In 24 hours, it'll start to look even better. You're gonna do lymphatic massage where you start in the middle and milk swelling out. Morning and night, you can use my really awesome eye cream for that. At 2 to 3 weeks, we'll see you back.
I'm really happy, thank you. I feel so much better. I already see a big improvement, and it's only been like 20 minutes, so I'm really eager to see what it's gonna look like when it's fully dissolved in a couple weeks. I really wasn't sure how I was gonna look after because I didn't know how much of the puffiness was actually the anatomy of my eye and how much of it was the migrated filler. So I'm actually really happy that the majority of it, I believe, was the filler, because this eye without the bruising looks pretty flat.
It's so important to do your research. When you are looking for someone to work on your tear troughs, please realize that currently there are no FDA-approved products for use in the tear trough area. So all of us have been placing filler in under eyes because of our experience. And if we have years of clinical experience, we can place it with accuracy, precision, and safety. And for people who are seeing someone who's an inexperienced injector, who really is just dabbling and doesn't do this on a regular basis, you can expect to have problems. And you need to be so careful. This is your eyesight.
I have no makeup on under my eyes. I removed my concealer, and I have a little bit of bruising on this eye, which is totally normal, so I'm not worried about it. Going forward, I think I'm gonna do a little bit more research on, the product that I wanna use, and of course, I would recommend using a doctor that you really trust, who's super knowledgeable. Just do your research and be safe.